If you're watching this at the beginning of 2026, there is going on right now a court case with the Supreme Court about conversion therapy. If you have heard of this term and don't really know what it means or what it covers, this episode of No Silly Questions is for you. No Silly Questions is all about LGBTQ FAQs and fast facts. There are no silly questions, so ask yours at outcenter.org/questions. Well, it's always important to define our terms. So instead of actually starting from the term conversion therapy, I want to talk about a term that encapsulates more than just conversion therapy and conversion practices. And that term is this one, SOGICE. SOGICE is an acronym that stands for Sexual Orientation and Gender Identity Change Efforts, which are interventions that seek to change individuals' attractions or sense of self to fit heterosexual and cisgendered norms. To put it another way, these are attempts to make LGBTQ plus people straight or not gender expansive. It's important to talk about conversion therapy, of course, but also this broader, more general term. That's because some people try to get around some ethical or even legal bans on conversion therapy by saying, well, we're not doing some of this violent stuff. We're just doing some more covert types of practices. The term SOGICE covers all of these different things. That said, it's still important to talk about this key term, conversion therapy, or some people call it conversion practices because, well, therapy is supposed to be helpful and useful and evidence-based, and certainly these practices are not. So conversion therapy is a type of SOGICE. It can include overt practices like we've talked about, such as electroshock therapy, aversion therapy, or even religious exorcisms. And yes, people still try all of these things. Conversion practices can also be covert, such as through quote-unquote ex-gay support groups, peer pressure, group shaming, or behavior modification. It's important to start from, well, just the facts. And the facts are these practices don't work, right? If what's on the label says this will make you not be gay or like people of the same gender as you or have a different experience of gender, well, there's no evidence at all that these practices are effective. And even worse, there's more evidence that shows these practices actually cause harm. So really, it's also important to understand the underlying assumption that inspires conversion practices, I guess. And that assumption is that being LGBTQ is wrong or disordered or somehow broken in some way. But the reality is, being LGBTQ plus is not a mental disorder or illness of some kind. It's a natural variation of human sexuality and gender identity. Here's some context. Until 1973, being gay was officially classified as a mental disorder by the American Psychiatric Association. But in December of 1973, the APA board voted to remove homosexuality as a diagnosis. And in 1974, the full membership confirmed it. So, what changed after 1973? Well, for one, we stopped pretending that being LGBTQ plus was a problem that needed fixing. Throughout all of history, people have been gay. People have been lesbians. People have loved people of multiple genders. People have been trans. It's always been in history if you just look a little bit. And so, in spite of the evidence, in spite of honesty, conversion practices continued. But what does conversion therapy or conversion practices look like in practice? And further, well, why is it so bad? Well, let's address that directly and talk about some common misconceptions about conversion therapy and what it is and what it does and why it's not very good. Okay, maybe we can come up with some broad categories to think of different types of conversion practices. One type might be talk therapy, like what you might go talk to your therapist or counselor about. Another type are religious-based approaches. Another type includes behavior modification, and another includes aversive techniques. So let's start with talking about talk therapy. So it might seem on the surface that when a non-affirming practitioner engages in conversion talk therapy that, well, is it that big of a deal. I mean, it's not this electroshock therapy stuff. Well, there's some problems with this on a few different levels. For one, it's unethical for clinicians to engage in this type of behavior, primarily because clinicians are supposed to be using the best practices. If a clinician is deciding ideologically to try to get their clients to not be queer or LGBT, well, this isn't exactly following best guidance. The best guidance is a affirmative, non-directive approach. Well, you're not trying to get somebody to do what you want them to do as a clinician. Being able to confront conversion practices and talk therapy is super important for everyone, but especially for young people. Young people's brains are still developing. They're forming their sense of self. They're learning who they are and what they believe about themselves. So when a trusted adult, like a therapist who is in a position of authority, is trying to tell them that, well, have you thought about not thinking about who you're attracted to? Or have you thought about just following the rules about how you should present as a specific gender that society has told you should present in? This is actually a kind of psychological manipulation. It isn't allowing clients to fully understand who they are. Young people are being told this by licensed clinicians. And essentially what they're being told is who you are is a problem to be fixed. So this isn't just words. This is an attack on people's sense of self and identity that can lead to an internalized sense of shame that can last for decades. Now let's talk very briefly about these religious-based approaches. So religious-based approaches of conversion practices and SOGICE can include praying the gay away, right? Sermons or youth group talks and things like that that are intended to use the position of authority to manipulate people into thinking a very specific way about gender and sexuality. It involves using just random people's interpretations of ancient texts to describe how people need to, in today's world, live, despite the fact that those ancient texts didn't necessarily have enlightened views about patriarchy and gender and sexuality. Talk-based methods of religious practices can also cause harm, right? And it's more than just a trusted authority figure. It's a trusted authority figure who's telling you God finds a problem with who you are. Behavior modification is another form of conversion practices or SOGICE. This includes forced practices carried out by teachers or parents. Sometimes this is done in a well-meaning way, but it's still harmful. These are practices and activity, ways of being or acting that make somebody more masculine or more feminine. This includes restrictions on clothing, activities, forced dating somebody of the opposite gender or a different gender. This behavior modification is centered around the premise that there is a correct way to be a man or a woman, and because you're not doing it right, you need to be forced into it. I've already hinted at these aversive techniques or aversion therapy techniques throughout, but just to be clear, this still happens today. There are still electroshock therapies used, nausea-inducing medications that are given, and other methods designed to create negative associations with being gay or with gender nonconforming practices. These are not just historical, these are documented, and they still get used, even in the United States. So when people say that SOGICE or conversion therapy, it's just talk, it's not that big of a deal, people need to develop thicker skin or something, the answer is, it's talk therapy, or it's practices, or they are efforts that are designed with an explicit purpose built upon a false and manipulative premise. They are to make people ashamed of who they are. That's the entire point. The point is to get them to move from one place to another. That's why we call it conversion practices. And like I said, it doesn't work. Well, I take that back. It does work. It does work at creating shame. It's shame that's just the opposite of healing. Well, let's dive deeper into that. What makes conversion therapy actually harmful? I'm not just going to tell you that the APA says it's bad. I'm going to explain what actually happens here. And you want to know what happens? The outcomes of conversion therapy and SOGICE? Let's go through the list. For one, severe depression. So this isn't just situational ups and downs. This is clinical depression that persists long after the conversion practices have ended. And as I mentioned before, research shows that people who have experienced conversion practices have significantly higher rates of depression throughout their lives. Next, PTSD and trauma symptoms. People exposed to conversion practices have greater symptoms of post-traumatic stress disorder than those who don't. Internalized homophobia and shame is another one. This is this cognitive mechanism, right? People internalize the message of what they've been taught, right? That something is wrong with them, that how they are and who they love is broken and wrong or maybe sinful. And that helps them develop deep, lasting shame. They come to believe that being LGBTQ plus is fundamentally broken, and that belief shapes how they see themselves and affects everything from how they live their lives to their relationships to how they think about self-care. And here's what I mean. I'm not going to beat around the bush here. Conversion practices lead to higher rates of suicidality. This is perhaps the most devastating finding. People who have experienced SOGICE are significantly more likely to attempt suicide. One major study found that LGBT people who experience conversion practices are almost twice as likely to attempt suicide compared to their peers. For trans people who were exposed to conversion practices, there is an increased suicide risk that persists long into adulthood. So let's be really clear about this. Suicidality, internalized shame, these aren't side effects. See, success in conversion practices are measured by how much people suppress themselves, how much they can turn off the part of them that's LGBT. That is not therapy. That's abuse dressed up in therapeutic language. The APA realized that their conclusions were wrong, and like good scientists, they learned from that, and they changed. So let's just recap what we covered today. Conversion therapy is a set of harmful practices that are based on a false premise that being LGBT is something that needs to be changed. But conversion practices and SOGICE do not work. It causes real psychological harm that's been documented in research for long periods of time. Every major medical organization in America says it should stop. The UN says it should stop. The World Health Organization says it should stop. People who care about other people say it should stop. But understanding what conversion therapy is only one part of it. This is just the beginning. In future videos on this series, we're going to talk not just about the documented harms, but what happens to people as they come out the other side of conversion therapy. And we'll also talk about what you can do. There are many levers that we can pull, no matter who you are. We'll talk more about those strategies in a future video, so stay tuned for that. And thanks for coming along with us on this pretty heavy topic. But it's something that we should know about, and it's something that we should stand against. So let's do that together. If you are appreciating this content and learning from it, please share it with your friends. Please share it with other advocates and activists in your circles. And also, if you want to see these videos continue going, you can support our work. Just go to outcenter.org/donate. We appreciate your gift.